welcome back. I am so excited for this episode about hormone replacement therapy, which I will refer to as HRT. It is one of my favorite topics to speak about because I have found so much benefit from it personally, as well as in my clients. But one episode is definitely not enough to cover it all, between the myths and misconceptions around hormone replacement therapy, the type of hormones to use, the different forms, how to get started, where to find a provider, and more. So I'm definitely going to be breaking it down into future episodes. But let's talk about one common misconception about HRT, which is that you have to wait until menopause to start. It's actually now referred to as MHT, or menopause hormone therapy, but many providers won't use that term because it can lead women to believe that they have to wait until they're menopausal to start, and that couldn't be further from the truth. In fact, the use of HRT in younger women had a beneficial effect on the cardiovascular system, reducing coronary disease and all-cause mortality. And according to GP and pioneering menopause specialist Dr. Louise Newson, HRT is most effective to start when you are perimenopausal, which is the years leading up to menopause. And of course, that looks different for every woman. Some women start a couple years before menopause, while others start over a decade before menopause for symptom management. Now, most women would benefit from replacing their hormones starting in their mid to late 40s. But for some women, like myself, starting earlier is necessary and improves quality of life. Like everything with health, there is no one size fits all, and HRT is no different. In case you missed the memo, hormones are kind of important. In fact, we have hormone receptors in every organ system in our body. And in our mid-30s, as we start to lose hormones, our organ function starts to decline. The importance of hormones simply cannot be overlooked. So if somebody tells you that it's no big deal to lose hormones, it's a natural part of life, please send them my podcast. All right, so a little backstory on me. I took hormonal birth control, like many women do, for about 13 years of my life. I was told that it would help my terrible periods by regulating my hormones. No one informed me of the potential side effects, long-term health repercussions, the fact that they were synthetic hormones, the risks associated with those, the fact that hormonal birth control suppresses our body's natural production of hormones and halts ovulation, which, by the way, is a really important event in our monthly cycle. Without ovulation, you do not make a robust amount of progesterone. Progesterone has a calming effect. It's needed for healthy pregnancy, helps you better handle stress. It improves your PMS symptoms, supports memory, is essential for bone and heart health. It supports a healthy thyroid, improves your sleep, and can even minimize migraines and joint pain. So yeah, we kind of need progesterone, and not just for fertility. While we do make small amounts all month long, ovulation is what triggers your body to make this miracle hormone in robust amounts to make us feel good and to offer all of the health benefits that I mentioned. So back to my story. While I was on hormonal birth control, over time, I developed mood swings, depression, weight gain, thyroid nodules, cystic breasts. I actually had to have a cyst surgically removed from my right breast in my 20s. And eventually, I developed a prolactinoma, and that is a benign growth on my pituitary gland. So I learned at a pretty young age the impact that hormones have on our health. And when hormones are out of balance, whether they're too high or too low, it can cause life-altering symptoms and health risks. So my experience really is what catapulted me into this line of work, learning about women's health and hormones and how to support my own body with a healthier lifestyle. I saw such great improvements over time that I became so passionate about this, and I went back to school after a decade of working in the corporate world to become a women's health coach. So as a functional health coach for the last decade or so, I have followed a really healthy diet and lifestyle, as you can imagine, and was thriving, even with a prolactinoma. Until I hit my late 30s, things started to change. That's when I started to experience anxiety, disrupted sleep, loss of focus, brain fog, joint pain. My cycles got longer. I had vaginal dryness, hair loss, low mood, a leaky bladder, which is lots of fun, and even weight loss resistance. I was having a really hard time losing some weight. It was easy to gain and hard to lose, which I know a lot of you can resonate with. All of these symptoms were associated with perimenopause. So I ran some comprehensive blood work to look for different patterns, but mostly I paid attention to my symptoms. They are the most telling. You do not need a test to determine if you are in perimenopause, all right? I also tracked whether or not I was ovulating, and I wasn't. As you learned earlier, no ovulation means no robust progesterone production. So, since low hormones increase the risk of chronic diseases like heart disease, obesity, Alzheimer's, osteoporosis, and more, I was in my late 30s, which can be perimenopause territory. And based on my health history, I decided, along with my doctor, to start HRT to not only get ahead of the curve, but also to improve my quality of life, because it really was having an effect on my life, my relationships, and my business. And as you can tell, I'm incredibly passionate about this work, about helping other women, and I did not want my symptoms to get in the way of that. So, in the 10 plus years that I've been doing this work, I have learned the importance of hormones and knew that eventually I would have to replace mine. It wasn't even a question in my mind. So, I started to dabble with over the counter products in my mid 30s. But when my symptoms became too much to handle, that's when I made the decision to go the prescription route. As the dosing is higher, it's more effective for symptom management as well as long term health benefits. So, after testing my thyroid marker several times, I decided to tackle that first because my thyroid did need some support. Because when thyroid function isn't optimal, nothing's gonna be. So, I started on T4, which is our inactive thyroid hormone, only because I wanted to assess how my body was converting from that T4 into T3, which is the more active and useful thyroid hormone. Now, I retested after starting that probably about 6 to 8 weeks after, and my doctor and I didn't see that much improvement, not only in my markers, but as well as my symptoms. So we decided to add in T3. Again, that is the more active thyroid hormone. And at the time of this recording, I am taking Tyrosint, which is T4, as well as Cytomel, which is T3. Now, since adding in thyroid hormone, my joint pain and my hair loss improved. And I even lost weight, and I've been able to keep it off, which is awesome, especially in this stage of life where so many women experience weight gain and have a really hard time losing it. So we increased thyroid hormone over time to improve my symptoms even more, as well as my levels, and they have. But thyroid hormone hasn't been enough to manage all of my symptoms that I mentioned earlier. So I knew that the next step was to get on top of my progesterone, estrogen, and so on. So the next thing I did was I added in oral micronized progesterone, and that is taken at night. This greatly helped with my sleep as well as my anxiety. However, I still struggled with not getting into that deep sleep. I was waking up in the middle of the night. I was still dealing with some joint pain, vaginal dryness, memory issues. My mood was still not great, and I still had that annoying leaky bladder. Like every time I would sneeze or cough or laugh really hard, I would have a little leakage, which is just not fun for anybody. So I decided, based on my research, that these were symptoms of low estrogen, and I started estrogen replacement therapy. I am using an estradiol patch at the time of this recording, and it's a very convenient way to get that dose of estrogen. You could just put the patch on your butt or on your abdomen, and it's worked pretty well for me. Now, that has made a huge difference in the rest of my symptoms. My sleep is deeper. My joint pain has greatly improved. So has my mood, and even that annoying leaky bladder. Now, I do still deal with some vaginal dryness, and that typically indicates that you have low systemic estrogen or that you still don't have enough. So I may be increasing my estrogen patch again, or I may even switch to like a compounded cream so that I could better titrate and experiment a little bit more. But for now, DHEA and estriol suppositories can actually help, and they have helped me with that one symptom. The last symptoms that I felt needed additional support were my brain fog, my focus, and memory issues. And as you know, this can be really challenging. It's frustrating. And again, having a business, I need to be sharp, right? My brain needs to be working every day. So after testing multiple times and not seeing a major improvement in this area with the other hormones that I was taking, I decided to add in testosterone therapy, which has been shown to help with cognitive issues in this stage of life. And I have opted for a topical compounded cream. Now, there are no FDA approved testosterone options for women at the time of this recording. Hopefully, that will change soon. Some providers will prescribe male testosterone for women off label at a much lower dose, but I opted for the compounded cream, and that is working for me. So, adding testosterone was actually the most challenging, which I didn't expect because I immediately noticed oilier skin, some breakouts, and even some bloating. And testosterone converts into estrogen. So I also noticed that my last several periods were a little bit heavier and even a little painful. I had some cramps, which I haven't had in a really long time. Now, that doesn't necessarily mean that I need to back off of my estrogen. I am just going to experiment with even increasing my progesterone because I feel like I'm at a pretty good place with my estrogen. I even said earlier that I may have to increase a bit, but with heavy periods, painful periods, typically that means that your progesterone isn't enough. So I may increase that and see how I do. But basically, when you start HRT, it's not just like a set it and forget it. It definitely is a process. It takes some time to fine tune your dosing and really see what works and what doesn't for you. All right, all of that said, hormone replacement therapy, while I love it, while I have found so much benefit from it, it is not a Band-Aid. It is one piece of the puzzle in your perimenopausal journey. You must be making food and lifestyle changes, as well as ensuring that your gut is in tip-top shape to properly metabolize these hormones. You want to make sure that you're detoxing efficiently and that you have the proper nutrients on board to support all of this, which is what we help you do in the Hormone Rescue program, in addition to providing guidance and education on HRT. All right, I hope that gave you some insight into why I started HRT, and I've encouraged you to be open-minded and continue to get educated so that you can make informed decisions about your health. Hey, before you go, if you're resonating with this podcast and realize that your symptoms are anything but normal, my 6-month comprehensive program, The Hormone Rescue, may be a great fit for you. My team and I help women in their mid-30s to early 50s improve symptoms such as fatigue, disrupted sleep, anxiety, erratic moods, bloating, and so much more. We do this by utilizing functional testing, comprehensive blood work review, a personalized plan tailored to you, women's health and hormones education, and ongoing support. If you're ready to commit to your health and feel better than you have in years, check out the link in the show notes to learn more about the Hormone Rescue.